So the main symptoms that we see, it's low energy, feeling tired. The libido is a big thing.
You cannot go to your general care practitioner, primary care doctor, and ask them to be optimized.
I'll have patients come to us all the time. They're like, Doc, I just went to my doctor. I passed with flying colors.
Yeah.
And I'm like, how are you feeling? I feel like crap. I'm like, all right, let's try to dig deeper.
Talent of the practitioner comes is to be able to interpret
Yeah.
the lab markers versus what the patient is actually feeling. Because if you just focus on the labs, then you're treating a piece of paper.
We are only as strong as our hormones, especially as we get older.
People will look at their life as pre and post optimization. The light comes on, the energy, the sexual function, the physical strength, and the stamina.
We have built a platform where we're educating the patient to empower him.
You should be able to not have any limitations on your life, and that's what hormonal optimization gives you.